Welcome to MBBS Atlas. In this video, we are going to talk about the blood indices. Now, what exactly are these blood indices? See, the blood indices, they check the quality of the RBCs, check the quality of the red blood cells. Now, the quality of RBCs, how do they check the quality of RBCs? By determining the three parameters. The first one is size, the second one is the color, and the third one is the concentration of hemoglobin in the RBCs. So quality of the RBCs are checked by blood indices by three parameters. First one is the size of the RBC, second is the color of the RBC, and the third one is the concentration of hemoglobin in the RBC. Understanding these blood indices help us in diagnosing various types of anemias. So for understanding anemia, we need to be thorough the concept of these blood indices. Okay, before entering into the topic of blood indices, we'll be first discussing about something known as PCV, the packed cell volume. PCV is also known as hematocrit, and it is defined as the percentage of total blood volume occupied by red blood cells. So it is defined as the percentage of total blood volume which is occupied by RBCs. Okay, it is mathematically expressed as volume of RBC by volume of blood. Okay, volume of RBC by volume of blood into 100. Okay, now the normal ranges of PCV differs from age to age and gender to gender. So in an adult male, it is from 40 to 54%. In adult female, it is of 37 to 47%. In newborns is about 50 to 60%. I want you guys to remember these values. These values might be asked as MCQ. See, each value has difference of 10, so it is easy to remember. So 40 to 50, 37 to 47, there is difference of 10. In 50 to 60, there is difference of 10. So it is somewhat easier to remember. Okay, please try to remember. Now, what exactly is the significance of this PCV? This PCV helps us it indicates to know the oxygen carrying capacity of blood, and it is used to calculate the RBC indices, and it helps in diagnosing anemias, polycythemias, and dehydration. Now, what are the various conditions which alter the PCV? So, the increased PCV is seen in polycythemia, dehydration, and chronic hypoxia, whereas decreased PCV is usually seen in various types of anemias such as iron deficiency anemia, hemorrhagic anemia, and nutritional deficiency anemia of nutritional deficiency of B12 and folate, which is called as megaloblastic anemia, and also in overhydration. Now we have roughly seen what PCV means. Now we'll be entering into the concept of blood indices. Before entering into the concept of blood indices, I want you I will give a rough idea on the blood indices. See, there are mainly four blood indices, in which three are main. The first one is MCV, the second one is MCH, and the third one is MCHC. MCV is mean corpuscular volume. It indicates the size of RBC. The second one is the MCH, mean corpuscular hemoglobin. It indicates the weight of hemoglobin in each RBC. And MCHC, it indicates the concentration of hemoglobin in RBC. Okay, please remember this. Please have a rough idea. MCV is for size, MCH is for weight of hemoglobin, and MCHC for the concentration of hemoglobin in RBCs. Now we'll be studying them in detail. So mean corpuscular volume, the first one is MCV. It indicates average size or volume of the single RBC. Okay, and MCV is mathematically expressed as PCV into 10 by RBC count, or hematocrit into 10 by RBC count, and its units are micrometer cube. Remember the units. Units are very important. They will be asking in Viva. Micrometer cube, and the normal ranges is from 78 to 94. Now, the important takeaway which we need to take from here is, we all know that the RBC has a particular size. and our particular size of RBC helps in carrying oxygen to the tissues, right? So basically, what is the function of RBC? Function of RBC, RBC has hemoglobin. Oxygen bonds to hemoglobin and carries to tissues, right? So size of the RBC must be normal for the normal carrying capacity of oxygen. So if the size of RBC is increased, or if the size of RBC is decreased, oxygen carrying capacity will be affected. So if size of RBC is increased, we call it as macrocytosis. Okay, if the size of RBC is decreased, we call it as microcytosis. If the size is normal, we'll be calling it as normocytosis. Okay, now we'll talk about MCH, mean corpuscular hemoglobin. As discussed earlier, mean corpuscular hemoglobin, it indicates the weight of hemoglobin in packed cells or red cells. It is mathematically expressed as hemoglobin into 10 by RBC count. This is PCV into 10 by RBC count. This is hemoglobin into 10 by RBC count. And its units are picogram. Its normal range is 27 to 33 picogram. And now the clinical significance is increased MCH is seen in spherocytosis and megaloblastic anemia. Now what is this spherocytosis? We all know that the RBCs are biconcave in shape. By chance, if the RBCs turn into spherical in shape, it is termed as spherocytosis. Okay, so the spherical RBCs become spherical in shape in spherocytosis. Okay, now the third one is the mean corpuscular hemoglobin concentration, MCHC. It indicates the hemoglobin concentration in packed red cells. Okay, now its mathematical expression is hemoglobin by PCV, HB by PCV. Its units are gram per dl or percent. Gram per dl or percent. Its normal range is from 33 to 35 gram per deciliter. Now, for MCV, we have talked about size. For MCHC, we'll be talking about color. So, normal MCHC indicates normal color, which is known as normochromic. Decreased MCHC indicates the less color, that is hypochromic. Increased MCHC indicates the more color, which is known as hyperchromic. Okay. And the next blood indices is color index. Color index, basically it is not that much important, but we'll be just looking at the mathematical expression. So color index is expressed as hemoglobin percent by RBC percent, and its normal range is from 0.85 to 0.15. Some books also mention 1.10 as the normal range. We can choose any of the thing. Next, the color index is not used for diagnostic purposes as normal range of RBC is very wide. What does this exactly mean? See, the count of RBC differs from the person to person, from age to age, and from gender to gender. Newborns have different type of RBCs, the different count of RBCs, and males and females also have different counts of RBCs. So color index is not an ideal indicator, or it is not used for diagnostic purposes in many examinations.